Good afternoon. My name is Roel Steenbakkers. I'm a radiation oncologist from the Netherlands. I would like to thank the organization and Xtraal to give the opportunity to give this presentation. My presentation will be about radiation therapy for Ledderhose disease, the Dutch randomized study experience. First of all, I do not have anything to disclose, and this is what I'm going to talk about. First, our experience in the Netherlands at the UMC Groningen. I will give you some update about the trials. I have some preliminary results, and I will end with future perspectives. First, our experience in Groningen in the Netherlands. Since 2008, we give radiation treatment for Ledderhose disease. And up to 2012, we did use orthovolt, and from 2012, we did use electrons. Our treatment dose is the standard 30 gray. We give 2 times 15 gray with a split around 10 weeks. And our standard field margins are depicted in the picture, 25 millimeters in the distal to proximal direction and 50 millimeters with the lateral and medial direction. There's quite some literature about the radiation and Ledderhose disease as depicted in this slide. I do not expect you to read it all, but there are 3 studies performed in the past. Unfortunately, all these studies are no randomized trials. For that reason, in the Netherlands, radiation therapy for Ledderhose disease is not reimbursed by the insurance companies since 2013. And they claim that due to lack of scientific evidence for efficacy of radiation. And therefore, there is a need for a randomized controlled trial. Until now, we performed 2 studies, the Ledderhose study, which is a multicenter phase 3 double-blind randomized controlled trial, and the Ledderhose LTE study, standing for long-term effects of radiotherapy. These are the 2 studies which have been performed. And first of all, I will talk about the Ledderhose long-term efficacy study, which is a cross-sectional cohort study about the long-term effects on pain reduction, side effects, but also patient-rated outcome, like satisfaction and treatment burden. We collected 67 patients with Ledderhose disease in the time point from 2008. And the data collection was by means of questionnaires. From these 67 patients, we included 102 treated feet, 28 males, 39 females. Mean age at the end of radiotherapy was 55 years. In the meantime, after treatment completion was 5 years. Most patients also suffered from Dupuytren's disease, some males from Peyronie's disease. 50% of the patients has a positive family history, and 13 patients underwent surgery prior to radiotherapy. And these were mainly the patients in the beginning of the time when it was not known that radiation was beneficial for these kind of patients. Some results, when we look at the pain score, the mean pain score prior to radiotherapy was 5.7. And at the time of the assessment, so at the mean time of 5 years after radiation, the pain score is 1.7, and the difference is significant. When we look at the pain response, we saw that 42 feet had a complete pain response, 38 feet had a partial pain response, 32 patients had a stable pain response, and none of the patients had progressive pain. Some side effects, 10 patients reported dryness of the skin, and 2 patients erythema of the skin, and 9 of the 10 patients reported dryness after 4 years, and therefore it seems that dryness of the skin, if it appears, that it will persist over time. The evaluation of the treatment, 69% of the patients reported a permanent positive effect on the pain. 78% of the patients were satisfied with the effect of the treatment, and 57% of patients did not consider the treatment burdensome. If you go to the Ledderhose study, the Ledderhose study, as I said before, it's a multi-center phase 3 double-blind randomized controlled trial. It consists of 2 treatment arms, a placebo and a radiotherapy arm. And the placebo, all the treatment was the same, but patients were not actually irradiated, but we gave a sham irradiation. So patients were on the radiation machine. The patient did hear the radiation sound without actually being irradiated. The study was unblinded after 18 months after treatment. And the primary outcome of the study is pain relief at 12 months using the numeric rating scale, the NRS. Secondary outcomes are pain relief at 6 and 18 months, quality of life, nodule size depicted by ultrasound and MR, walking abilities, the 10-meter walking test, and also we used some sophisticated pressure walking ability to see whether patients had different walking issues, and also cost effectiveness and economic evaluation, and also safety and toxicity. The first patient was included in January 2018, and 84 patients were included after 20 months. We did think that it would last for 2 years, the inclusion, but the inclusion was ended before that date. So actually the inclusion went very well. Very recently, in August 2021, the last patient was unblinded and the data is complete. And we now started with the data analysis, and I will show you some preliminary results. As I said, we included 84 patients, 130 feet were in the study. 5 patients were dropouts prior to the 18 months follow-up, and the baseline characteristics were the mean age of 56 years, a little bit more females than males. The affected feet, 25 only at the left, 13 only at the right, and 46 both feet were radiated. And the treatment arms were very nice balanced. 42 patients received the placebo, 42 patients the radiotherapy. And within the placebo arm and also the radiotherapy arm, the male and female ratio was the same. What you see here is our main endpoint, the mean pain score. What you see that at baseline, the mean pain score for both groups was around the same. After 6 months, also the mean pain score at the placebo arm and also the therapy arm reduced, but the difference was not significant. At 12 months and at 18 months, the pain score, the mean pain score was different between the two the different arms. And as you can see, the pain reduction increased over time with the radiotherapy arm, and with the placebo, it was more or less the same. Actually, we were quite surprised that there was a very large placebo effect, but fortunate when the time was passing by, the placebo effect was diminishing. When we look at quality of life, we saw that also at baseline, the quality of life score the placebo arm and the radiotherapy arm was lower than the Dutch population. And after 6 months, we saw a dramatic increase of quality of life score with the radiotherapy arm, but also at the placebo arm. And at the placebo arm, it remained stable at 12 and 18 months. And with the radiotherapy arm, it was almost similar to the Dutch population, showing that after radiotherapy, the quality of life score in the radiotherapy arm is similar to the Dutch population. Some future perspectives. What I showed you were some preliminary results, and we are finalizing our analysis of the Ledderhose study, and we hope that we very soon will publish this. In case that it's indeed a positive result, we are going to convince the Dutch Healthcare Institute that radiation for Ledderhose should be reimbursed, which is currently not the case. And I think that our Dutch patients will be very happy when that it will be the case. And of course, we will further collect data with a longer follow-up, looking at long-term effects of treatment. That's what I wanted to present you. And now I would ask you if you have any questions. Thank you for your attention.
Thank you, Dr. Steenbakkers. So the first question for you, what is the timing of the US MRI assessment after treatment?
If I understand the question correctly, what the timing of the ultrasound and the MR is? Is that correct?
Yeah, the ultrasound and MRI assessment after treatment.
Yeah, we did for every patient. We do have an ultrasound and an MR before the start of the treatment, and after 1 year. Unfortunately, I do not have the results on that yet. But although we have the impression that ultrasound is a little bit more suitable for evaluation, but that's currently under investigation.
Okay, next question. How do you place the time gap and dose in the 2 courses of radiation therapy?
Actually, the time gap is based on the publications of Segensmith, which have been advised to put that on between 6 and 10 weeks. And actually, we did choose to do that on 10 weeks. And for all the patients, we did use the same, so there was no difference in gap. So we were very strict on that.
Okay, thank you. And then final question, what was the dose schedule of RT used in the Ledderhose study for Ledderhose disease? What was the dose schedule of RT used?
So for we did use 30 gray. So in the first week we give 3 times 5 gray. I waited for 10 weeks, and then again 5 times 3 gray, if I say that correctly. So 2 times 2 weeks of 5 times 3 gray, so 30 gray in total. And of course, in the placebo arm, no radiation was given.
Okay, thank you so much.